Hello everyone. Choosing a right apparatus is pretty important if you are trying to look at any one single particular manifestation. For example, if it's the distal limb manifestation that you are really interested, then you'll have to depend on something known as staircase test, where the rat grabs the pellet. It climbs the stairs and then grabs the pellet using forepaw. Alright, then that will show the forelimb manifestation of the Parkinson. So, there is something occurring in the axial muscles. I hope you remember from the previous discussion as to what the axial muscles are. Those are important for posture and gait. So, does your study include the study of posture and gait? Then you probably have to remember use something gross like cylinder test, or there is a swimming test, or if it's a gait that you are interested in, then there is these kind of pressure monitors which is called Nolder's Catwalk system, where only the gait is affected, which becomes slow and rigid, sometimes even bradykinesia comes in. So, you need to decide what is the manifestation that you are interested in bringing out in the particular model. Alright, so injection of exotoxic drug into particular target does lead to all the manifestation, but which manifestation are you really interested? There are non-motor manifestation as well. For example, it can cause extreme anxiety, it can cause a lot of stress in the animal. There are psychiatric manifestation that can happen after the induction of Parkinsonism, because the same basal ganglia circuitry has 2-3 components. One is the motor component, then there is emotional component, then there is sensory limbic circuitry component. So, which is the aspect of which aspect of basal ganglia are you really interested in to study, and you need to choose that particular behavioral setup. Alright. So, I have chosen Rotarod for for the reasons that I am going to describe later, which will give us the fall time. Alright. So, if your experiment does not really demands a lot of detailed evaluation of these forelimb movements, or the axial or the gait does not really matter, all that you are going to see that whether the Parkinsonism has manifested or not. So, it is a simple classification that you are really interested. If the Parkinsonism has manifested, then an instrument like a Rotarod is more than sufficient. Once you prove that Parkinsonism has manifested, then you can plan your intervention, be it a drug or an implant, to validate your implant or validate a drug once you come to know that the Parkinsonism has manifested. So, these are basically the objective ways of looking at the manifestations. As I said, as I described earlier for stroke model, you need to have some sort of objective way of looking at these clinical manifestation after you induce a particular model. So, this is again for the gait, where the rat has to walk along this narrow path, and there is also a treadmill that can be used, which is popularly used to study the gait changes that can happen once you induce the Parkinsonism. So, again it can be hemi-Parkinsonism or bilateral Parkinsonism. If your injection is for both sides, bilaterally if you are injecting, it can cause bilateral Parkinsonism. Commonly we use hemi-Parkinsonian model, where one half of the body is commonly affected. Alright, so these are the various test apparatus that are available, and there are some simple tests that you can include to look at the manifestation and easily come to a conclusion whether the rodent has manifested Parkinsonism. So, one such test is the string test, where the rat has to really grab the string and balance itself, and then you can really assess by the time taken it to fall. The normal rat of course can balance well, but Parkinsonism falls earlier. There is something a crude way of checking as compared to the Rotarod, which will have a bit more objective ways of looking at it, or the pole test where the rat climbs down, by crawling onto that pole and reaches down, or it's going to just slip and then fall directly. So these are some of the simpler ways of trying to say whether there is this Parkinsonism as manifested or not. So I'll just run this video. This is another way of looking at how the gait of a rat can be studied objectively. You have a motivation of the feed in the end of this tunnel where the rat walks, and as the rat walks there is this strip of pressure monitor belt that is kept. You can see the rat running, and you can definitely count the number of steps the rat has taken and the pattern of steps and the pressure applied on that pressure sensitive monitor. This strip, I'll just run it again. So if you see that as the rat runs towards the feed that is kept at the end of the tunnel there, it runs towards it because it is motivated to run. That is the idea of having that entire a feeder box at the end of the tunnel. You can see these green lights. These are pressure sensitive pads which are fluorescent strips which will tell us how many steps are taken in what time, and then the pattern. It generally takes that pattern to reach that particular target. Alright, so very easy to assess objectively how the rat's gait has changed, how much the pressure that is being given by the hind limb and the forelimb. So, and then you can compare it with your post intervention behavior. So, this is another good system if your research questions involves gait analysis. It does not really tell much about the forelimb movement, the grasping movement, all that is not possible. This is mostly when you can your study involves the gait analysis. All right. So now let's look at the look at another very commonly used test apparatus, which will tell us whether the Parkinsonism has manifested or not. So, and that test apparatus is Rotarod. The beauty of this particular equipment is that everything is automated, and you will get a data using the user interface monitors that are provided along with this particular setup. This is just one prototype example. There are many other automated behavioral setups that are available in the market. So, all that I am trying to say is that if your study requires only the manifestation of Parkinson, it is a gross way of checking it. You are not trying to look at the forelimb function, or you are not trying to look at the psychiatric manifestation. This particular apparatus gives you the motor manifestation. Alright, if you remember the motor manifestation, the most important is akinesia, rigidity and postural changes that can happen once the Parkinsonism sets in. So, it helps in motor coordination and balance of rodents such as mice and rats. It can be used, and it typically consists of rotating rod or treadmill like apparatus. This keeps rotating. It is obviously a rotational rod that is available, and you are going to mount the animal on top of that rod. And there is a fixed time which you can actually keep varying. The number of rotation that happens in a minute can be varied. You can make it slower, or you can even change it. So, rotates at a constant or accelerating speed, and the goal is for the rodent to maintain its balance and stay on the rotating surface. So, that is the task that you are going to use to see whether the rat has taken up all the features of Parkinsonism, whether the neuronal cell death is manifesting in terms of these kind of behavioral manifestations, whether it is it really able to balance itself on the surface, on the rotating surface, and then you look at how long is it really maintaining, and that comes to the parameter of fall time. What is the time taken for the rodent to fall off from this rotating surface? So, it is the central component. Just to brief you all about the different components of this particular setup, there is a central component and it is a cylindrical or oval obviously, and the surface can be smooth, textured or grooved to provide varying levels of difficulty to the animal. Of course, once it becomes smooth, it is more demanding, alright. If the manifestation is only subtle, you are not able to see any difference, then you better check with different textures, because obviously when you inject a particular drug into the target, it might possible that you might have missed the target completely or partially. So then obviously your manifestation will have a spectrum with a full blown Parkinsonism to a very mild degree of Parkinsonism. So that is the beauty of such apparatus, that it can bring out even a subtle change in the gait and balance, alright. So the diameter rod can also vary, which again influences the difficulty of the task for the rodent. So obviously the smaller diameter will be definitely more challenging for the animals to balance on. And then there is a acceleration mechanism given, where you can make it faster or slower based on the animal's ability to adapt for the changing conditions. So it all says that before you induce Parkinsonism, you need to sort of get the entire spectrum of the rodent behavior by changing the diameter, changing the surface, by changing the acceleration. So this particular apparatus is pretty flexible to accommodate for all those manifestations that can happen depending on the spectrum of the clinical features that can come up with your cytotoxic agent injection, alright. And it has also the animal holding chamber, which was individual compartment. So it is possible to put multiple rats and mice, but generally a single rat is preferred. If you are trying to look at only the fall time, then you can manage with multiple rats at the same time, but the training also should go to the same timing, and then this animal should come in the same channels without altering the channel that you have chosen. So there are different components, component 1, 2, 3, and then the data that comes out will also have these components, alright. So obviously there is a fall detection system where the sensors are implanted on these paddles that are in the bottom. As soon as the rat falls, these sensors detects automatically what time the rat has fallen. So it is a sort of an automated system where the entire recording goes on, wherein it notes the trial time when the rod started rotating, alright, and then the fall time, alright. So entire thing is recorded in its user interface. So what are the parameters that can sort of varied to for your entire experiment? So the rotation speed can be varied, the test duration, the number of trials, and of course the rest period. So these are grossly the operating parameters in this particular equipment that can be varied to see as to what has changed after you induce the Parkinsonism with this injection. So any of these can get affected, but we need to make sure that it pre and post remains the same. So there is certain precaution that you need to consider before you subject the rat for this particular test apparatus. So you need to ensure that animal is acclimated, that is, without switching on any of the apparatus, you need to let the animal hang on for some time in this particular behavioral apparatus, similar to what we saw in the Leisure test apparatus, where you need to let the rat to get acclimatized so that the stress factor is taken care of. Obviously you need to handle the animal pretty gently, and then make sure that the animals are healthy and free from various other conditions which can affect motor function, alright. So for example, if you have used the sedation, you need to make sure the sedative has come off, or if there is a drug which is being used due to any reason, then you need to make sure that it does not really affect the motor function. Those becomes the confounding factor for this particular experiment. So, obviously the rat should not have any wounds or ulcers in its forepaw, and there should not be any spinal deformity wherein the spinal cord itself is affected. If you are not really subjecting your animal for preclinical MRI, then you need to make sure that structurally, grossly, the animal is walking normally before you subject for this particular experiment, because those factors does affect the gait and posture itself. Alright. So, then obviously without starting the Rotarod, you need to let the animal in the testing chambers briefly to get, so that the habituation happens. So, you need to set up the Rotarod and you need to check the appropriate parameters on the Rotarod, including the diameter, rotation speed, check the acceleration setting, and then of course the test duration need to be fixed. So, all that is done, and then you need to look for the safety features, whether it is there in the place or not. Most importantly, the fall detection system should be operational. Though the rod the rotates and then it falls, but then if your fall detection system is not working, obviously you will miss the entire data, or you will have to end up in visually analyzing it, which is going to be definitely more tedious. So, the preferably one animal at a time is placed on the rotating rod in its designated chamber, and then you start the Rotarod and begin the test trial. Alright. So, you need to record each time the animal spends on the rotating rod before falling off or gripping the rod. Alright. So, normally it's keep walking and try to balance itself on the rod while it rotates, and ultimately loses balance and then falls on these plates, which picks up the fall time. You need to make sure that you notice any sort of motor impairment in terms of unsteady gait or trying to, the balance is really difficult to be maintained. All this can be noticed while the rod rotates. Alright. So, you need to make sure that you conduct multiple trials. As I said, there is a huge spectrum of any behavior that you are trying to study. So, you need to get the average of the entire spectrum to say yes, there is a significant change of based on your intervention, or for that matter even the manifestation of Parkinsonism. So, you need to allow sufficient time between trials for the animals to rest as well, because fatigue is one component which confounds your results, because fatigue also cause the rat to fall off. Parkinsonism also will cause the rat to fall off from the rotating rod. So, let the animal rest before you subject for another trial. Alright. So, that is very important. And then you need to allow time to record the data and include the time spent on the Rotarod for each trial. Any variation in its performance between trials among the different group of animals should also be noted. And data analysis, in these automated setup, data are automatically obtained using the various parameters that I just discussed, and there is a good user interface that is available to collect the data. But the most important thing is you need to involve the statistics for the analysis to make sure the variation in the performance is taken care of. Alright, because there can be significant differences between the experimental groups. So, there should not be any false negatives or false positive which is coming in interfering with the ultimate interpretation of the data. Alright. So, definitely there are additional factors, as I said, for the stroke model, that you should consider age, sex, or the treatment condition to be homogeneous. Alright. The older rats obviously will spend less time, and the younger rats probably spends more time. So, you need to make sure that those factors are homogeneous, which are actually confounding factors by itself. Alright. So, that is how important it is. Though the task is simpler, there are n number of parameters that can confound your results and can give a lot of false positive and false negative results in your interpretation. So that's exactly what I'm trying to say. You need to summarize the findings in a report, including the methodology results, and then ultimately you conclude what you have observed in this particular experiment. And then obviously the implication of the results, you need to discuss the implications of the results as well in the context of the research objectives. As I said, this Rotarod is not going to bring out every manifestation that we just discussed, rather it is just going to focus on the gait and balance. So that is something you need to keep in mind throughout your experiment with any of the apparatus that you have chosen. And then of course you need to subject with follow-up experiments depending on the outcomes, so you can add multiple layers. For example, you conducted Rotarod experiment just to prove that there is Parkinsonism. Maybe you can have another open field test or cylindrical test or even the swimming test, or rather maybe the multiple tests like staircase test which will evaluate the forelimb function. So you can add on multiple other experiments along with this which are synergistic. One probably would check the gait and posture, another test probably will test the forelimb functions. So you can have multiple other experiments to follow it through to make sure that all the cardinal manifestation of Parkinsonism is covered. Alright. So obviously when it comes to the software interface, there are safety features. The grossly the components will have data acquisition system, there are safety features, there is software interface, and of course the environmental control. So this is a very good software interface that is available to play around with multiple parameters that I just said, whether it be it a rotating speed or the texture, or the time taken for the entire trial, all that can be noticed, and even when it falls, this system automatically picks up the time that the rat has fallen in each compartment that is available on the Rotarod. So you can see the response time that is taken for the rat to fall once it's tired, or probably or when it is even the Parkinsonism rat, this time is definitely going to go down in Parkinsonism. So that can be easily monitored using the software interface. So this is the example of the log sheet that is available in the user interface itself. If suppose your setup does not have this user interface, you can definitely monitor the behavioral outcome using such records where you can give the direction, you can give the identity of the animal, what sex it is, and then which compartment have you really placed the rat, and then of course the rotating speed that you have chosen for that particular trial, and then of course the experiment number and the date. So when you look at this, there are these values where different response time has been recorded, and of course it also gives it in the pictorial representation where you can plot the responses over different trials, and of course for the different rats if possible together. So these are the some of the examples of our own experiments where Parkinsonism was induced by injecting the 6-hydroxy dopamine, and the response time was recorded. So the response time is basically the fall time, after how much time the rat has fallen off from the rotating rod. Alright, so that is very important to understand and analyze as to how and when the rat has developed Parkinsonism. So based on which we can plan the further experiments. So that comes to the conclusion of the session on behavioral apparatus. So it is very important that it is not just these experiments that we have covered in this session. There are many more such examples and many more ways of inducing Parkinsonism. It is better you get familiarized with all those methods, but then these methodology probably would serve you as an example or a sort of a foundation to start off. But then it's very important to understand the disease process completely before you design your behavioral setup. That's very important. Understand the pathophysiology and what is the manifestation of that particular disease that you're trying to address, and then try to replicate that in the behavioral setup. Then only then you can consider that the intervention that you're really considering, whether it is a drug intervention or you're trying to look at the pathophysiological mechanism of that particular disease, then only then you can document the entire changes in the behavioral outcomes. So behavioral models plays a very significant role when you're trying to consider various such interventions. So that comes to the end of this session. Maybe if possible we'll try and have a practical session as well, where the hands-on exercises can be tried out. Try it yourself with various surgeries that are possible, various implants that are available to perform those surgeries. Then how do you really assess the behavioral setup? So there is a significant learning curve in all these surgeries that we discussed, and even the behavioral setup that we discussed. So let's see if we can really plan those hands-on exercises and workshops as well whenever possible. So thank you all for the kind attention. See you all.